Hi, I'm Tim Marshall. Welcome to R&B Showcase. And today we have very special guests. You know, more people today are becoming very health conscious, and there's different alternative methods to maintaining good health. And we have a special guest joining us here in the studio, and he is from Acupuncture in Haddonfield, New Jersey. We're going to be talking about acupuncture. Welcome our special guest, Dinh, to R&B Showcase. How you doing, Van?
I'm pretty good. Thanks for having me here, Tim.
Well, it's good to have you here, man. It's been quite a while since we tried to get you here in the studio, and I know we had the opportunity to meet a while back at the gym and working out, and now we got you here working out in the studio. So I'll talk about acupuncture today. So why don't we just begin at the beginning? I mean, this is something I'm really interested in, as many other people surely are. Tell us a little bit about acupuncture. What is it?
So acupuncture, it's very traditional Chinese medicine. It's been around for about 3,000 years now. A lot of people come in for different types of injuries, physical injuries, and then we treat a lot of other things too. So stress and anxiety is a big factor in what we focus on for chronic injuries, and then in gastrointestinal stuff, Bell's palsy. There's a lot of things you can treat with it. And I think the biggest thing that people has been coming in for recently is post-COVID symptoms.
Mm-hmm.
Yeah.
Mm-hmm. I was going to ask you about that because people are like there's a lot of stress due to the pandemic, a lot of anxieties due to the pandemic. And how does acupuncture work?
So the easiest way I explain it to people is the needles are hair-thin needles. It causes micro trauma to certain points we inject it in. And your body responds to it. All that blood flow starts rushing to those areas. Big endorphins and dopamine effect starts to kick in, and it really relaxes you. A lot of times too, with people who have like pain and tension, when there's tension anywhere in the body, a lot of us hold stress tension in the shoulders and neck. When we put needles there, it just really relaxes that. It opens a lot of blood flow to that area. And it relieves a lot of that pain because of the endorphins are kicking in.
Okay, so someone who is suffering with anxiety, this is a good alternative method for them, I guess, in relation to like other types of therapies?
Yeah, so I say 60% of people come in for physical injuries and pain management. And then I'd say the other 40% of people, they come in for stress and anxiety. It helps people a lot because it's kind of like I explain it to people. It's like the after effect of a workout. All the endorphins and dopamine starts kicking in, and people feel more relaxed. And after like a couple of treatments, most patients, after a couple of treatments, they come in as needed when there's stressful times in their lives, more stressful than others. So like we'll get a lot of teachers that come in, and beginning of the school year, they'll start coming in a lot and reduce that stress level. Yeah.
Interested that you mentioned teachers, because I'm also an educator. I teach school, and in addition to the radio and television. So what does a particular acupuncture session, what does it look like?
So if it's your first time coming in, it's going to be about an hour to like an hour and a half. What we do is we check your pulse, look at your tongue. That just gives us a diagnosis and your constitution, what's going on in the body. What other symptoms are you having with combination of stress? So like people who are stressful, they could have a lot of tensions, like I said, in their shoulders and neck, but then other people has stress in other areas of the body. So I'd say another patient will come in for acid reflux, a lot of tension in their abdomen area, maybe hip pain, lower back pain because of the amount of stress they're going through. People hold stress in all different ways.
Mm-hmm. About the musicians, a lot of musicians, watch this program and listen to our radio show, and entertainers. And how do you think acupuncture could be beneficial to people in the entertainment industry? Actors, whoever.
Yeah, so I'd say I have a handful of people who are musicians and people who play like the violin or people who play the piano. They're in that position for a pretty long period of time. Also, people who are musicians who sing a lot too. So there's going to be a lot of tension in their throat and neck area. So what happens is what we do is we try to release that tension. And Usually patients will say the vocal cords, their vocal cords, opens up a little bit, and we feel like we have more air and oxygen coming in to sing that. A lot of times that tension comes in from the muscle of the pec minor, which prevents us from, singing even louder than we can, and giving that voice that we usually do. Especially, we just overwork. A lot of times we overwork, and we just need that energy. We need that relaxation to help us sing better or play that instrument better. A lot of athletes come in, same thing. It's all about recovery.
That's very interesting. Great to have this as an alternative method to maintain good health. Now, talking about good health, you're also a doctor.
I am, yes.
Tell us about the training it takes to become an acupuncturist.
So it's 4 years of undergrad. All right, my undergrad was in kinesiology, the study of human movement. It's a 3-year program for acupuncture. It's a master's program. And after your 3 years, you have a year for your doctorate if you wanted to get your doctorate. Some acupuncturists, they'll do herbs too. So that's another 2 years. So herbal medicine is pretty big. I'm not an herbalist, but it's just another natural way of helping people.
So how would an acupuncturist work in comparison to other physical therapists or a chiropractor? How does that, is it complementary, or is it, go along with it?
Yeah, we all work together. So basically, a sports medicine doctor will diagnose what's going on. They'll send it to a chiropractor, physical therapist, and acupuncturist. And usually patients will see all of us, which gives them the best results. So we communicate with each other. If I were to refer to a physical therapist, I tell them, hey, listen, this person has lower back pain. Some of these muscles need to get strengthening. So let's strengthen them up. And vice versa, they'll communicate the same thing with me too. So what I do is I release a lot of the muscle tensions. I also activate the muscle. So a lot of the sessions, we do a lot of electrical stimulation with acupuncture. So for instance, if someone has lower back pain and their glutes are weak because they're sitting all day, then I put a needle in there and I activate those muscles, stimulate with electrostimulation, and it's gonna feel like they did a 30-minute workout.
And how about folks like myself, like lift weights and like to exercise a lot? Say if you have like tendons or something that are sore, how does this help with that?
It's all about blood flow and circulation. So that's going to help with your soreness. That's going to help with your recovery. A lot of times we overwork a muscle, and we just need to release that tension with acupuncture, with certain modalities. So even not only we work with physical therapists, we work with chiropractors too. And it just goes all hand in hand with the healthcare profession.
Well, I know, like I said, I met you working out at the gym. What is it that made you decide you want to do this, become acupuncture? What about it made you, sparked your interest to want to train to become an acupuncturist?
Yeah. So when I was 16, I was playing football, and I tore my ACL meniscus. It swelled up pretty bad, and my parents were like, before we went to see the doctor, they told me, why don't you just go to an acupuncturist, just help with the pain and everything. And I went to an acupuncturist over in South Philly, and he helped me a lot with the inflammation that was going on, the pain, the range of motion. And then I stuck to physical therapy. And then my physical therapist, she was like, what do you want to do when you grow up? And I said, I don't know, something in the business field. And she said, why not physical therapy? And I was like, oh, that's a lot of years in school. I don't know about that. And I just went to school for physical therapy. So in undergrad, you have to take undergrad classes first, and then you apply for PT school. But during that time, I had a class called History and Philosophy of Kinesiology, and the professor told us to pick a controversial topic, and everyone was picking like PT stuff, and I wanted to do something different. And my topic was, instead of taking opioids first as as a relief, why not try acupuncture before you even think about that? And then down the research, I found out it can help with not only physical pain, it can help with a lot of other things too, like internal stuff, like I was mentioning, stress, anxiety, gastro stuff. It helps so many things, and it's very hands-on. So I found a school about 30 minutes close by, and I checked it out, and here I am. Yeah.
Would you say the acupuncture is pretty much growing in popularity? Because a lot of people are not as familiar with, this type of alternative medicine. So
yeah, I'd say it's grown pretty big now. It's been mainstream. A lot of insurances covers it.
Okay.
A lot of people don't know that they have acupuncture coverage, but it has been mainstream, and a lot of doctors around do refer out and recommend acupuncture.
Now, a lot of people want to know questions. Is it sanitary? Is it safe? You're sticking needles in people. I mean, tell us about how, about that part of it.
Yeah, so it's very hair thin needles. You'll feel like a pinch or prick to them, nothing painful.
Okay.
All the needles are sterilized, and it's one-time use, and we dispose of it in a sharps container once we send them out. Back then, it was different. Back 3,000 years ago, in cavemen, they would just burn the needle back to sanitize it.
That's everybody's is in everybody's mind, those early days. But they don't realize this is the actual medicine and something you went to school for. Obviously, you have a license to do this, which is a good thing. And how long did you say it took you to become an acupuncturist?
So 7 years to get my master's, right? And then total of 8 years for the doctorate.
He's still such a young guy. My goodness.
Thank you.
Yes, that's a good thing, man. I'm glad you came down. I'm excited to hear about this acupuncturist and really, learning more about it. So what can you demonstrate something? Show us what actually goes into acupuncture, what a typical session may look like.
Yeah. So like I said, it's about an hour sessions. It depends on what you're coming in for. We have to diagnose you first. I did bring needles to demonstrate.
All right. That was my next question.
Yeah. So I have
interested in seeing that.
I have some needles with me, and then I'll demonstrate what some people come in for. Some people come in for tennis elbow. So I guess
now explain what tennis. Some people might not know what tennis elbow is. That's when your back of your elbow sore in the back. Yeah.
So a lot of the tension is going to be in this area here. It's mostly due to overuse. They call it tennis elbow because a lot of tennis players do have it.
Right.
Because all that repetition of hitting, it causes a lot of absorption right in the elbow area. So there's going to be a lot of tension there.
I actually got that from lifting weights, believe it or not. Pulling on the lap machine, pulling down on that lap machine. And for a while, I couldn't lift because it was back right in here. It was very sore and painful to I couldn't lift weights. I couldn't do push-ups. Couldn't do anything. It was,
a lot of people get it. Yeah.
It took a while. It took about a year almost.
It does take a while. Yeah. So acupuncture just really speeds up that process.
And I have a friend of mine who's actually got a pinched nerve in his shoulder. How would that help that pinched nerve?
So it depends where the pinched nerve is and if it's radiating down the hands or not. Pinched nerve, a lot of times it's a lot of that muscle tightness that's causing that pinched nerve. And then the other thing we want to look at if there's any like herniation or bulging disc around the cervical that causes it to radiate downwards.
Right. How long do we think it would take for something like that to heal, though?
It depends. So if it's a chronic issue, it takes a lot longer to treat. Right, you need more sessions. It depends on the severity of it too. So if someone comes in for more of acute and not as severe, then usually patients that come in, they'll see a difference within anywhere from 1 to 3 treatments.
Oh, wow. Okay.
And then after 1 to 3 treatments, we do week to week until you're 100% or you hit a plateau.
Okay. So these are hour-long sessions, basically. So about 3 or 4 sessions, you should start trying to see a little bit of a difference. Do you have regular clients that just continuously come for different things, or?
I do. So I have regular clients that come in for stress anxiety. That's the biggest one. And I have regular clients that come in because it's just the wear and tear they put on their body. So in today's world, we sit a lot at a computer working. So it's a lot of tension in our neck and our lower back. So it's basically the nature of their job. They come in for a tune-up. If you're a construction worker, You come in for a
truck driver, maybe
truck driver, a lot of sitting. Anything that requires laborers, hands and feet, they come in just for maintenance.
You mentioned school teachers. You have a lot of school teachers that come in.
I do, yeah. I actually went to I went to school in Cherry Hill, and a lot of the teachers from there come in. Yeah,
wow. They probably don't even know you're the guy that's doing it. They say, I had you in my class.
Yeah.
As a teacher, I get that. I work in radio, but as also education, as I mentioned. But as a teacher, I get that a lot. You see students, they don't, seeing you out of the classroom, they're always surprised that you do different things. So yeah, that's a good thing.
Yeah,
good thing. So
I actually started supervising at the acupuncture clinic in Warminster.
Okay.
This semester.
You do a lot of traveling back and forth, huh?
Yeah, it's not too bad. I live in Palmyra, so it's about like 30 minutes away.
Okay.
35 minutes, yeah.
Very good. Okay.
Yeah.
Excellent. So tell us about your facility. Where is it located in Haddonfield?
So it's right by downtown. So it's on Haddon Ave, in between Haddon Ave and Tanner. It's right by the Haddonfield Library.
How long have you been in that facility?
So I started in 2018. As soon as I got my license, I started right there. And so it's been about 4.5 years now. And it's on the lower level. I actually partnered up with a chiropractor and strength and conditioning coach. So we try to make it a one-stop shop. Yeah. So it's more integrative. So patients will see all three of us. You just see faster results with that.
Now, when you're doing your acupuncture, what's the mood like? Is there a certain setting, lights? Is there music playing? Is this the Motown in the background? I mean, what's going on?
Yeah. So some people will ask for different music, right?
Okay. That'd be me.
Yeah. So
put some Temptations on.
most of the music, it's pretty zen. It's pretty zen and relaxing music.
Cool.
But then other people, they're like, "Hey, can you put this on?" I'm like, "Of course, whatever helps you relax."
Right. That's cool.
Yeah.
That's very good. Very good. Well, you got a demonstration you want to do for us today? Show us how to. Show us how this works. People are probably anxious to see. Let me
bring this out here.
Okay. I guess those are the needles you're bringing out there.
So this is a cup, right? It's a silicone cup.
Wow.
We do cupping in the facility with acupuncture.
Okay.
Depending on what you need it for. So if that person has tightness, we'll do some cupping. So I'll just demonstrate real quick.
Yeah, I'm getting afraid. What is cupping?
Yeah. I don't know if you watched the Olympics of Michael Phelps back then.
Right.
He had all these like purple marks.
Okay.
That's cupping. It really helps release a lot of that
Wow.
muscle tension and helps with recovery. The darker it is, the more tension and lactic acid you have.
Oh wow.
So if you're not that, if it's not that dark, then there's not too much tension there. So it shows based on what it looks on the skin.
Okay.
I'll do it on my elbow just to give a demonstration.
All right.
So this is a different type of cup. There's different types of way for cupping. There's sliding cupping. There's cupping where we just leave it on there. There's suction cupping.
Okay.
This is silicone, so I can just easily just put it on here. Just like that.
Okay.
Yep. And then I'm going to bring the needles out.
So the cupping is first then, basically, right?
Well, so in my treatment room, we usually do the acupuncture first, and then we do the cupping afterwards.
Okay. Now, is there preparation before you do the acupuncture or something you have to do for the person?
Yeah, so
calm them down or something, or
so what we do is we do an assessment first. See what they're coming in for, right? If it's for like physical pain, we have to see what muscle is weak, right? What muscle is tight. Where the pain is coming from, we got to find the root of the issue.
Okay.
We can't just treat the symptoms, because if we treat the symptoms, then it'll come back. We got to find that root of the issue.
Okay.
So these are the acupuncture needles here.
Okay.
Very.
Now, what are they made out of? Are they?
So these are stainless steel.
Oh wow. Okay.
Yep. And then we have Syrian acupuncture. This is the Syrian ones.
Okay. This is very interesting. I mean, I know, like I said, a lot of people are wanting to know more about acupuncture. So this is great that you're doing this demonstration for us.
So this is a tube that we use, right? So it'll be less painful.
Okay.
I'll needle my elbow right here. So a lot of time with tennis elbow, a lot of that tension is here.
Mm-hmm.
And usually patients will feel a lot of that pain on the bone here.
Okay.
So we want to get right into the meat of that muscle. So very hair thin needles, you'll feel like a pinch or prick to the sensations that patients might feel. Could be like an achy feeling or dull feeling while this is happening.
Okay.
During this time, we leave it for anywhere from 30 minutes to 40 minutes. Right?
You getting needles in for 30 minutes?
Yeah.
Okay.
Yeah. So if someone comes in for stress anxiety and you're all pinned down, you're forced to relax.
Right.
You can't go anywhere.
Right.
You're forced to relax. A lot of time we don't have that quiet time. Like people say they relax. Hey, I'm gonna watch on TV, but their mind's still going. They're watching,
especially with
TV.
the phones and everything.
Exactly.
Put them phones down.
Yeah. So this is a straight hour treatment of just full relaxation. They're forced to sit, lay down, and relax. But right here, about 30 minutes in, a lot of that blood starts rushing to the area for more blood flow. With more blood flow, the healing process starts. It causes an inflammation response right there.
Okay.
So a lot of times patients, for the first like 24 or 48 hours, they might feel sore from the treatment. So they might feel worse before they start feeling better. Right. And then after that 24, 48 hours, then they start to feel pretty good. Usually, like I said, anywhere from 1 to 3 treatments to feel a difference. And it also depends on age too.
Okay.
So our nervous system is not as great as we age, right?
Okay.
The younger population, so I'll get high school students, I'll get pro athletes, their nervous system is very heightened. So they respond a lot faster to acupuncture. So they could respond right away, right after the treatment.
Okay.
For someone that is older and that had the...
When you say older, what age are we talking about? 30, 40,
honestly,
50, 60, 70?
It depends. It depends on their nervous system too. And it depends on how healthy they are.
What is the gamut that you've had, like as far as age-wise? And you mentioned athletes and younger people. What is the gambit of clients that come to your facility?
I say 40 plus.
Oh, wow.
Yeah,
okay.
A good amount is about 40 plus. Then I'll have a handful.
Any high schoolers or younger people?
Yeah. A lot of high school athletes come in.
Okay.
Yeah, for sure. But most of the demographics is 40 plus. The body starts breaking down. You just got to start taking care of yourself at that point.
Okay.
Yeah.
So when you're sticking the pins in yourself, is it like you said, there's soreness for 48 hours? Is there any type of marks left on your body, or people probably want to know, that may be apprehensive about it?
Yeah, so I'd say some people might have a little bruising. It doesn't happen often, much at all. No pain in that area. Just maybe a little bit of bruising because it might have broke the blood vessel a little bit. But other than that, not much markings. The cupping might give you the most marking out of all of them. We'll do cupping, and then we also do gua sha.
What is that?
It's a scraping technique. I didn't bring that with me.
Okay.
So in physiotherapy or chiropractic world, they'll call it Graston technique. Right. It's another form of bringing more blood flow. The reason why we can't heal because there's lack of blood flow and circulation to those areas.
And this helps helps increase that blood flow.
Yeah, exactly. Yeah.
Oh, okay. Like how about varicose veins and things like that? When there was I guess it would help with blockage or.
So varicose veins. What we do is it's called 7-star needle. It comes in like a tube. I'm gonna take this out.
Okay.
And it comes in a tube, and then there's 7 needles. And what we do is we start pricking that area, and a lot of that blood starts coming out. So you'll see a lot of blood with that treatment, but not a lot of people come in for that type of issue. Right. Yeah. Blockage, we talk about blood blockage, or in Chinese medicine terminology, we talk about blood and qi, right? Qi is energy. Qi is vital energy in the body. So whenever there's a blockage there's going to be pain. Yeah. So the acupuncture helps move blood and qi. Which will reduce the pain.
Now you're doing acupuncture on yourself today. And when you need stress relief, is this something that you do, or do you have someone else actually perform acupuncture on you?
Yeah. So if it's for my knee, I can do it myself. If it's for stress relief or anxiety relief or just relaxation, I have friends who are acupuncturists, so they do acupuncture on me.
Okay. So are these people that are in your organization, or is this like different organizations, different companies that help out?
Yeah. So I actually last year I brought an acupuncturist aboard. Her name's Anne-Marie, and she'll do the acupuncture on me. Or my friend down the street, Brittany, she'll do some acupuncture on me too.
Okay. So sometimes people think of acupuncture, you think of picking somebody laying down on this table and stretched out and needles all up and down their legs and their arms. What is the typical session? Are they usually laying down? Are they sitting up? I mean, what is typically done?
Yeah, so if it's something that has to be pain in the front, then I'll have them lay face up. And if we're doing like lower back or neck stuff, then we'll do face down treatments. Some people, it might be painful for them to even lay down. We do have massage tables, massage chairs to work on. Yep.
How can health conscious folks that want to know more about acupuncture and more information, or just generally get in touch with you?
So there's a lot of acupuncturists in the area. I don't think people know that.
Okay.
In the
I
South.
wasn't even aware of that,
Yeah, I'd say there's a handful in the local area, especially in South Jersey, Philadelphia, all the big cities. There's a lot of acupuncturists.
Okay.
Feel free to contact any of them. And usually people give me a call and they ask me questions of, hey, can you treat this? And ask me all the questions that you asked me, like what does acupuncture pertain? How long is it? How many sessions do I need?
Right.
I always answer those, so it's very helpful. And then there's one school around in Warminster, and they're very helpful in giving you all the information as well.
Okay. Now, do you have like a Facebook page or something so people can get in touch with you, or is there a website? Yeah,
I do. So my website, usually people book online, an appointment online. It's www.acupuncture.com. You can follow me on my Instagram and Facebook as well. And people usually direct message me and ask me, hey, I'm having this injury. Can you help me with this? And what's the treatment look like if you were to help me?
Very good. I appreciate that, man. And it's good information, and I thank you for the demonstration. Anything else you want to show us there? Did you pretty much nail it there?
Yeah. So I took the needle out, but usually what I do is I do a lot of electrostimulation. So this is the machine for the electrostimulation.
Oh, wow. Okay.
And it's alligator clips. I'll connect it. It kind of feels like an EMS machine, but it connects a little bit deeper. Because the needle is deeper to activate those nerves and muscles. Also with electrostimulation, it helps the recovery period. So it'll be less treatments that you need. Electrostimulation helps regenerate.
Oh, wow.
And it helps with the inflammation.
Now, all of these different methods that you're talking about here today, are these all in one session, or these are like you have to come back for multiple sessions?
All in one session.
No,
yeah.
Quite a lot of quality.
Yeah. It's all about quality for sure.
That's what you're doing.
Yeah,
that's good.
So it's a lot of hands-on work for sure for the hour.
Okay.
Yeah.
All right. Did you get a chance to work out today?
I did. I actually just came out from the gym.
Okay. All right. I'm going to try to get in there a little later on, though. But, man, I really appreciate you coming down and spending this time with us and giving this information out to our listeners and our viewers of the R&B Showcase. And thanks for coming down. And
thanks for having me.
And enlighten us about acupuncture. Like I said, I didn't know a lot about it. Now I'm more enlightened, and maybe try to come down there.
Absolutely. Thanks for having me.
Van Dinh from Acupuncture in Haddonfield, New Jersey, our special guest here. And want to thank you for joining us here on R&B Showcase. I'm Tim Marshall.